So welcome everybody. Welcome to this fifth OmegaNet webinar. I am Henrik Kolstad from the Department of Occupational Medicine, Aarhus, Denmark. And the title of today's webinar is Job Exposure Matrices, How to Use Them in Occupational Epidemiology. And we have three distinguished speakers, all three JEM experts, who will give their answers to this question. And I must say, important question. But before we start the webinar, Rachel has some important messages for you.
Thank you, Henrik. Good afternoon, everybody. So it's good to see you again. But before we start the webinar, I'd like to share with you two networking tools that have news on OmegaNet. And so the first thing that I would like to remind you of is on your right-hand side of the slide, you'll see the OmegaNet Training School. And I would like to take a few seconds to remind you that the registration for the training school is open, and you can register for free and see the full course program at the OmegaNet website. You can either go through the OmegaNet website or use this link in particular for the course. And so that there are still spots left, so vacancies for the course. And so you should please check this out, because this is a very interesting opportunity to learn on methods in occupational epi. The other thing that I would like to tell you about are this new tool on costs, which is the virtual mobility grant. So virtual mobility grants are similar to the previous short-term scientific missions that were funded when we still had in-person activities. And virtual mobility grants are actually funding for remote collaborations that don't necessarily require travel and accommodation abroad. There are several tasks that costs consider eligible, and many of them are actually conducted regularly in OmegaNet, such as data collection and analysis, the preparation of contents for communication, and even something which is new, which is virtual mentoring. And these grants are designed to support these sorts of activities. The only requirements in terms of the topic of the grants are the outcomes must generate benefits to the action, so that they must be built with that in mind. And the candidates, it's actually very broad eligibility, so they can be participants from full or cooperating member countries or observers from near neighbor countries. So almost everybody who has been working on the OmegaNet action. Submission for applications must be done online at e-costs, and in the coming months we will have 6 virtual mobility grants that will be eligible for funding. This means paying grantees up to 1,500 euros per virtual mobility grants, which is very interesting, even given that there is no travel and accommodation involved. So this is just a grant to develop a specific package of work. So there's going to be on the website, we will launch a call with different topics. So we will predefine some topics for these virtual mobility grants that people can apply to. And before that or after that, anytime that you have any questions on the virtual mobility grants or any other virtual networking tools or strategies, if you want to express you're interested in applying for a virtual mobility grant, please contact me at this email on the bottom of the slide, because I'm currently the Action Virtual Networking Support Manager. So please let me know whenever you need any kind of support for applications or for knowing how this works. Thank you, Henrik, and see you soon, and I hope to hear from you soon.
Thank you, Rachel. And we have a rather tight schedule for this 1 hour webinar, so I hope the presenters spend a little less than the 20 minutes that have been reserved for them so that we can have some time for discussions and questions and in the end. And you can use the chat function if you have questions or comments, or raise the hand, or just unmute and speak up. So I think the Zoom meeting should allow for this. And the first speaker, please, Susan Peters, will give a brief history of job exposure matrices. And Susan works as epidemiologist and exposure scientist at the Institute for Risk Assessment Sciences at Utrecht University, the Netherlands, where she is leading the occupational health group. And she is one of the central persons of the high-quality quantitative JEM job exposure matrix of quartz and several other lung carcinogens that I am sure that we will hear more about during the next hour. So please, Susan, the screen is yours.
Thank you. So I'll start sharing my screen and just checking if you can see the full screen now. Henrik?
Yes, it's fine.
Oh, perfect. Okay, good. So Henrik, thanks for the introduction, and I'll just try to stick within the 20 minutes. So I'll give a brief history of job exposure matrices. So how it all began? Well, even before I was born, so it's a while back. Gamble et al. Reported the use of occupational titles as a surrogate measure of exposure patterns, which was not a JEM as such yet, but it was one of the preceding efforts. And then in the 80s, the real JEMs appeared, and it was basically because when there was, well, it was not possible to get more detailed exposure information, that job titles were used as a surrogate. And in 1985, Penn et al., they developed, well, they actually called it the job exposure matrix and said, well, there was little advantage of direct estimations over a JEM. So it appeared to work quite well. And JEMs have been used as an exposure assessment method in occupational epidemiology a lot since then. And it's particularly useful for the reconstruction of the, if you want to look back many, many years ago, decades back, and want to study diseases with lung latency. And I think Lex will tell a little bit more about this as well. So there will be some overlap between the, but I guess it's good to have some connection between the different presentations, just to give you some background here. And before we move to what a JEM actually is, I wanted to say, well, we have, of course, the general population studies and industry-based studies. Within an industry, you can have detailed information about what people are exposed to, but in general population, it's really hard. Well, people work everywhere, and that's where the JEM comes in really handy. And I've highlighted two parts of this. If you have a community-based study, I think the second part here is that you have a full occupational history of all your participants, and this is where you can use a JEM for really, and when you don't have all the detailed measurements. So a couple of years ago, one of our former PhD students, now a postdoc at our department, Kelvin Good, did a review on what exposure assessment methods have been used in this type of studies, like in general population studies. And the most frequently used were self-reported and expert assessment, but followed by JEMs. So about 25% of the studies used a JEM. And if we then look at how that proceeded over time, so there are a few things here in this this graph, and I'll walk you through it. So the first column, I don't know if you can see the arrow, the pointer, but at the first bar, you see how many of these studies had a full occupational history. So you see almost all of them had full occupational histories, and by the different colors of the bars, you see the 80s, 90s, 2000, 2010s. So they all had, well, a lot of them had full occupational histories. But then if we look at the different methods that they use, this case-by-case expert assessment became more popular over the years, and self-reported exposure a little bit less in the last decade. But then if we look at job exposure matrices, the second last part, so to say, you see that in the 80s it was quite popular. Almost 40% of the studies reported using a JEM. And then it was a, well, slight drop there, but it became more popular in more recent years again. And I think, well, we've worked on quite a few of these studies as well. So, but you see, they have been used over the last 40 years. So if we compare these three methods, of course, self-assessment, it's good because it's relatively low cost, but the problem there is that you have, you have to depend on the knowledge of the worker, and it's hard to, they have to know the specific exposure, but it's also difficult for them to recall what they actually did. So expert assessment, of course, is often used as a gold standard because you can take into account all different types of information, but it's very labor intensive. So it costs a lot of money, costs a lot of time, and it's still subjective. So experts might act differently in the morning than in the afternoon, or over time they might get more experience and assess exposures differently. So then if we go to a JEM, the good thing is that it's a standardized assessment, within a study, but also between studies, because you once develop a JEM, and I will show you an example of how a JEM looks like. You get a standardized assessment, and you're not dependent on how an expert performs at that stage or how a worker recalls something. And of course, once the JEM has been developed, it's relatively there's a relatively low cost. You can easily apply it. The major drawback, of course, is JEM is not all. It's not a perfect method, is that it assumes exposure homogeneity within groups. So you assign a level to a job title, and you assume that all people in that job are exposed to the same exposure level. And I'll come back to that later. So how does a JEM, how does it actually look? Well, it's very simple. Basically, you just have a list of jobs. So here's an example. Please don't look at the exact numbers, but just to give you an idea. So you have a list of ISCO codes. This is a job coding, can be different systems. ISCO is an international system that we often use and often see in JEMs. Then you see the description of that job, and for every job there is an assignment for the exposures of interest. So in this case, asbestos, diesel, and silica. So you see for every job you say, in this case, 0 is no exposure, 1 is low, and 2 is high. So this is a semi-quantitative JEM, but it's just to give you an idea. So basically you have a cell per job title and exposure. So I already said expert assessment is often considered the gold standard. So what we did is, with a JEM we developed a while back for different exposures, but this is for asbestos. We compared that with the gold standard of expert assessment. So what we did here is, and I don't want to go into details, but this is a multi-center study on lung cancer. Well, you can see the colored countries on the map of Europe. And the expert assessment was done, and that was what the original study was based on. So that came to an odds ratio of 1.12. So the association between asbestos and lung cancer. But then when we applied the JEM, we found a very similar result. So overall, you would have had the same conclusion there. So you found 1.19. So you'd say, well, there's an association between asbestos exposure and lung cancer. But this was done in a much more efficient way, in that sense that we applied this JEM based on the job titles, and we didn't have to go through all these different questionnaires to assign exposures. And then if we look at the bottom line, we see heterogeneity. So this is heterogeneity in results. So we see that for the expert assessment, there's quite some heterogeneity across the different countries, and it's a significant value there. So, and for JEMs, we didn't observe this. So with this gem, we were able to get very similar results, but with less heterogeneity in these findings. And it's basically just show that the gem can work very well. But I really want to stress this important drawback of a job exposure matrix. So we assume that within a job title, the exposures are the same. Well, of course, we do know that people act differently over time. People have slightly different tasks within a certain job title, and exposures might, well, they will differ between workers within the same job title. So, well, we can't solve that with a gem in this case, but it's good to be aware of this. And especially, so it also depends on what exposure you're looking at. So especially with exposures that are highly dependent on the specific tasks. So for example, welding or degreasing, which are not so well covered by the job title, a gem might not be the best choice, and more specific questions might improve the assessment in those cases. So it's always a bit of finding the balance, but it's good to be aware of what the features of a gem are. So this is a major thing to keep in mind. So Henrik already mentioned this slightly. So where we wanted to go next from the gems that were developed in the 80s and the 90s, if we really wanted to go to quantitative exposure assessment. So because if you quantify the exposure levels, you can express the risk by unit of exposure, and you can give more, well, you can go from just risk identification to risk quantification, and it might be helpful for legislation, for health promotion, and also you can see if there are time trends, and there are a lot more things you can investigate then. So we really wanted to move to a qualitative gem, which we did within the Synergy projects. So for a quantitative gem, of course, you need a lot of measurements. So to go from just no exposure, low or high exposure, which is assessed by an expert for every job title, we collected a lot of measurements, coded that for every job title. So ideally, of course, you want to have measurements for every job title. That's unfortunately was not possible. And of course, measurements are not taken randomly taken. They're focused on the jobs that are exposed. But what we did here, just in a nutshell, is to build a database with a lot of measurements, link that with the gem that I showed you earlier for asbestos, but we had that for others as well. And with modeling, we defined exposure levels for every single job, but also with a time trend and different levels for different regions. And I think Vivi will talk about this a little bit more as well. So I'll leave it here for now for how this gem was developed. But that was just in a nutshell, and just to show that it could actually be applied. So the Synergy population is a lung cancer case control study, pulled data from 12 different European countries and Canada. So over 40,000 people in there with lots of jobs. Well, you can imagine that there are all types of jobs in there. And work histories covering a period of almost 85 years. So there was a lot of jobs and a lot of cells to assign an exposure to, which we could do with the SynGem. So we were able to, with all this data, so these are two examples for asbestos and silica papers where we have applied this SynGem, and that you can actually derive exposure response relationships for these types of exposure. And a gem could be applied to this large amount of number of cases which you actually need to study, for example, subtypes of lung cancer. So you cannot, if you had to do that with expert assessments, that would have taken, well, much more time, and especially if you want to do that for more exposures. So then I'll move to, and I'm rounding up, so I'm looking at my clock. So just I want to point you to the, well, some to a website of OmegaNet where we made an inventory of all different GEMs that are around in Europe and also outside of Europe, but a focus of Europe on Europe. And at this stage, about 37 GEMs have been, well, the information has been entered. So it's metadata on these GEMs, and it gives you an indication of where the GEMs are, what exposures they assess, what type of coding they used. So please have a look at this. And if you have, if you know about a GEM that is not in there yet, please enter the metadata. Because I think it's really important to have this overview of what GEMs are around for use. And of course, one of the next steps that will be done within the E4 project, the EU project, you can see the link if you want to have get more information, is to harmonize these GEMs and get towards one big GEM for Europe. But I think it's important to stress that if you want to harmonize that, it is not that you can ignore like regional differences, because we, of course, we know there are a lot of differences across the different countries. So that was what I was going to talk about today. So I think to take home, please remember GEM can be a very handy tool for exposure assessment in these large occupational studies. But really, well, it's important to recognize its limitations, and but also, of course, it can be very handy to have this type of tool to get standardized exposure assessment across countries, which is particularly important in this type of pooled analysis in multi-center studies. But still, yeah, do recognize the strengths and limitations both. So I want to thank you for that, and I'll give the floor back to Henrik, I think.
Thank you very much, Susan, for a nice and instructive talk. Because of the tight time schedule, I think we have to keep the questions for the end of the webinar, and I will then hand the floor over to Lex. And Lex, as most of you or all of you know, is head of the Department of Public Health of the Erasmus University Medical Center in Rotterdam, the Netherlands. And furthermore, he's the editor-in-chief of Scandinavian Journal of Work, Environment and Health. And important, this presentation, he is an occupational hygienist of training. And Lex, please, the word is yours.
Thank you. And given the the limited time, I will focus on 2 examples. And hopefully after the 2 examples, you understand a little bit more how you can appropriately use a job exposure matrix and some pitfalls. And the first point I want to raise is, why do we use a job exposure matrix? I think Suzanne already alluded to it. But let's have an experiment. And you think about the perfect study. And in the perfect study, you would probably not come up with a job exposure matrix. You would argue with your supervisor and your colleagues, well, let's have this large cohort, and then we follow people over time, and we do an exposure measurement of each person in the cohort, let's say every year, because exposure may vary. And then we do a cohort study, and we follow them up for 10 years, and then we're going to write this brilliant publication. By that time, you probably have burned 5 million euros in your grant, and you're still waiting for your results. So although in theory, we would like to have exposure assessment at the individual level, in most EPI studies, it only happens when you use questionnaires, but otherwise it is extremely difficult. So that's why the job exposure matrix have become more popular, because it's a more efficient strategy. You group people who are supposedly similar in one group, you do a few measurements in the group, and then you know basically the exposure of that group. My first example. This is a unique situation in the US, a study on dust exposure in coal mines. And in the US, in the old days, I don't know whether it's still appropriate, they had this perfect directive. You should measure exposure regularly of each worker in your coal mine. And you should also measure health effects, in this case, lung function. So in this particular situation, the researchers had a data set of approximately 1,100 coal miners. And for each coal miner, they had a certain number of measurements. For some, they had only one, but that was just few. For most of them, they had 3, 6, or 9 samples over an 11-year period. And actually, the average number of samples per worker was, I think, close to 20. Because it was in the directive, thou should measure dust. And so they did. And then each year, they also did lung function measurements. So now you have this perfect data set over 11 years. You have lots of individual exposure measurements, and you have 11 times the lung function measurements. So now you can link exposure to lung function perfectly. And what was possible in this data set is to ask yourself the question, if I have more measurements per person, does it affect the exposure-response relationship? And yes, the classical theory would say more measurements, you probably have a better characterization of the exposure of that particular worker. So in this table, it illustrates if you lump all the measurements together per person, you calculate the mean exposure, and then you link it to the decrease in lung function over time. Indeed, if you have more measurements, your exposure response association steepens, all according to the theory. Brilliant. But there are only very, very few studies that have these data sets. Most studies have just 1 or 2 measurements of an individual over time. And when you just have 1 or 2 measurements, what does this say of the true exposure? And even in the example of the coal mines, the authors asked themselves the question, can we improve the exposure assessment if we have important determinants of exposure? And that's what they did. They asked themselves the questions, well, what is an important determinant of exposure? Well, the time. There is probably a time trend in exposure. Maybe there is a systematic difference between one coal mine and another coal mine. And that contains information of exposure. Yes, and we can lump all the measurements together per person, but you know, persons do the same job. So let's lump workers together. If they do the same job, same activities, we lump them in the same job title, and we use the exposure measurements to assign them a particular exposure category. So the job axis would be the classical job exposure matrix. And the fourth option would be, well, we can actually, like Susan showed already, we can model exposure. That's a kind of JEM where you put in your exposure information as dependent outcome, and you can try to predict the exposure by these determinants. And to make the article even more interesting, they had an external job exposure matrix based on 3,000 measurements across all US coal mines, and they applied that same this external JEM to the 4 strategies you see above. And now we get a very interesting table. So the first figure I showed you before. So if you have lots of individual exposure assessment measurements, on average almost 20, this is the exposure response relationship. So per a microgram meter cube coal dust, there is a decrease in FEV1 of minus 4.4 milliliter per year. If you then use the simple job exposure matrix, we put together all the workers in 6 categories. And then you see that the exposure response association halves. Not 4.4, but 2.2. More importantly, your standard error increases dramatically because you only have 6 categories. Here you have 1172 data points, and here you have 6 categories. So in this situation, there is no significant association anymore. If you add the time, different strategies, 10 periods or 4 periods, you see that if you add the 10 periods to the 6 categories, it indeed contains value of information, and the exposure response increases again a little bit, but at the expense of a very large standard error. Another definition of time, exposure response drops, but here we get the interesting one. So we have a JEM with 6 job titles, and we add the mine. And suddenly you have an FEV1 that is larger than the individual based estimate. So here, apparently, if you know the job title and you knew the mine, that was very predictive of the exposure response association. Although you see the standard error is higher than the standard error at individual measurements. Here you have the exposure model, almost the same, high beta, lower standard error. And then lo and behold, if you use the external job exposure matrix based on 300,000 measurements in the US on this particular 1172 workers, then the JEM didn't perform that well. So here we see there are pros and cons of lumping together workers with different exposure strategies. So the conclusions of this paper, and I think it's a seminal paper, a classic paper, if you want to understand individual and JEM-based exposure assessment strategies. The conclusions is yes, the JEM-based exposure strategy can actually be beneficial if it adds the information on exposure determinants, like mine. But the problem is, it has an effect also on the standard error. So yes, you have a higher exposure response estimate, but you have a higher standard error. And if you only want to publish p-values below 0.05, you may run into problems here. What this example also showed is that the job was important, but especially the mine. The mine was very important. There were huge differences between the mines. And the results also showed that, I'm not going into too much detail, but the number of measurements per worker was very important, because if you have more measurements per worker, you arrive at a better estimate of the mean exposure of that worker. And it pays off in a way, because if you have only a few measurements per worker, then the true exposure of that worker is probably not estimated that well, and you cannot distinguish one worker from another worker very well. Let's shortly give you the second example. So we are now used to this idea of using a job exposure matrix. And now we are trying to estimate the quality of the job exposure matrix. And this was done in a study we did on asbestos and lung cancer. And this is simply the meta-analysis, the forest plot that you would publish. So here we have all the studies. Within each study, there is an exposure response relationship calculated that is reflected by the intercept, the alpha. Here we have the slope, that's the exposure response association, and here we have the standard error of the slope. And if you go through all the studies, you know, here you see the results. Most of them are actually not statistically significant. And you do a pooled analysis. And then luckily you have a slope of 0.13 and a standard error that is very small. So here we have a significant association. The pooled result is statistically significant. But what we have learned from this example is a few lessons. Lesson one is that the intercept, if you look at the intercept, we had some strange results. Here we had an intercept, almost 5. So the background rate of lung cancer mortality was 5-fold higher than expected. And that was coincided with a tiny slope with a huge standard error. And that is one of the lessons that we learned in this exercise, that if the exposure response relationship will be attenuated, so you have a particular slope and you cannot estimate that slope very well. It's actually attenuated by bias. It will tilt to the 0. Then because it tilts to the 0, it will increase the intercept. So be wary if you find a publication with a high intercept. That probably is an indication of bias in the exposure estimate. So then the next thing is that we try to estimate the quality of the JEM. And we have 5 basic criteria. Is there sufficient documentation so that you know number of measurements, the measurement protocols? The second one was what is the ratio of the highest versus the lowest cumulative exposure? Is there enough contrast, basically? Then some typical things for asbestos. You know, what is the type of measurement? And can you use conversion factors to link different measurement devices over time? The fourth one is more generic. So how much of the exposure data is actually covering the total exposure history of the workers? So is the exposure data that you have over a particular time period, is that reflective of the total exposure history in your study? And then the accuracy of job histories. I just pick one example. The coverage of exposure data to show you what happened. So one of the most cited studies, large study in Canada, this is the exposure history of the whole cohort. And you see that most exposure information data stems from the mid-70s onwards, and that covers only 10% of the exposure history of all workers in the cohort. So you have to estimate 90% of the exposure history, where you don't have many exposure measurements. Whereas here in an Australian study, a much smaller study, they actually had exposure measurements from the 80s to 2000, and the exposure measurement period covered 46% of the total exposure history of the cohort. So this is a much more preferable situation. By definition, this probably is a much better JEM. And then we looked at all these quality criteria, and overall what we found, and I'm drawing your attention to the bottom here, is if you have a JEM where the coverage of exposure data is more than 30% of the working histories of the worker compared to studies where the coverage was less, you see that the exposure-response relationship is much steeper. So more coverage, steeper exposure-response relationship. We saw the same with job histories. Insufficient job history versus sufficient job history information. If you compare the studies for their quality, you see that there is also a much higher estimate in the studies with sufficient quality of job histories compared to insufficient quality. We see a little bit the same pattern if you have sufficient documentation of the measurements. If the cumulative exposure ratio is high, then you find a steeper exposure response relationship. So overall, the conclusions were, if you have a better study, a better quality of JEM, and you subsequently exclude all the studies with a poor quality. So you first throw out 11 studies with insufficient documentation. Your exposure response relationship becomes steeper. Then you throw out another 5 studies with insufficient job histories. Your exposure response relationship becomes steeper. Studies with almost no contrast in the cumulative exposure. You throw them out, and again, you see an increase in the slope. So better studies, better job exposure matrices, increase in slope, but of course, larger confidence intervals. So the lessons from this example is, yes, the quality of the JEM had a huge impact on the reported exposure relationship. And in various studies, very typical for the asbestos lung cancer debate, the exposure response associations were substantially underestimated in some studies. And we think that we prove in this paper that is because of very poor exposure assessment, a strategy, a very poor job exposure matrix. So the job exposure matrix is not a solution unless you have a high quality job exposure matrix. And that's where the Omega Net comes in. You now have access to many job exposure matrices through the Omega network, and you can pick the best exposure assessment tool for your study. And my piece of advice is, look in detail into the quality of the job exposure matrix. Is it useful for your particular study? Does it reflect exposure patterns across jobs sufficiently? Do you have information on time trends? Is there important information on determinants of exposure in the JEM? Is it calibrated with real exposure measurements, a quantitative job exposure matrix? And then if you can answer yes to all these questions, then it's lots of fun using a job exposure matrix in your cohort study. And that is the end of my message, Henrik.
Thank you very much, Lex, for an interesting and inspiring talk. And I think we have to wait with questions to the end and move forward to Vivi Schlunssen, who will give a talk entitled Examples from Real Life, Quantitative JEMs, Various Agents, Various Outcomes. And Vivi, she's professor of occupational epidemiology at Aarhus University in Denmark. And she has a main interest in respiratory health effects of airborne exposure at work. And furthermore, she's the course leader of a quantitative PhD course or a PhD course in quantitative exposure assessment, on which both Susan and Lex are among the teachers. So be aware of it. The next course will be in November this year, I think. So please, Vivi, the screen is yours.
So thank you, Henrik. So I'm going to provide you with some examples from real life, and I will mainly show examples of quantitative JEMs, but also some other types of JEMs. And I think we have a time issue here, so I will try to do it quickly. And also both Susan and Lex have touched upon some of the same issues. So, okay, but here we go. Very short, why are we going to use JEMs? And I think there are three major and really good reasons for doing that. The first is when individual measurements are really not an option. The second is when individual measurements introduce systematic bias. And the third is when individual measurements introduce attenuation. And I will come back to those 3 points in more details. But first, I want just to show you some exotic examples, because now we are getting used to JEMs within the mechanical area and the chemical, more traditional area. But you can be sure there are JEMs out there for almost every exposure you can think about. The first one I will show you is a job exposure matrix on electric shock. It's from data from the US, where they have register-based information about the fatalities and the injuries caused by electric shocks. And by using this information together with a very tailored expert judgment, they were able to provide data like I show you here. So it's data of proportion of occupations within each major occupational group for median electric shock exposures. So you can see that there are really great differences within the major occupational groups. So if you see here, handlers, equipment cleaners, helpers, and laborers, they have the highest proportion of occupations with a high median electric shock exposure probability, whereas private households didn't really have any risk. The next, a kind of exotic exposure I will show you is daytime light exposure. So quite reasonable. Many people who are in this call, in fact, developed a quantitative general population job exposure matrix for occupational daytime light exposure. And it was based on measurement from more than 600 persons, and then together with expert judgment. And in fact, the modeling procedure was very similar as the one Susan told you about for SynGEM. And in fact, we were able to see a 30 times difference between highest and lowest exposed job by including a season, time of the day, among others. And we could show, we could explain more than 80% of the variability between jobs with this job exposure matrix. The second exotic exposure is plutonium. I think nuclear workers, they are very tightly monitored. For this cohort here, they have access to nearly 500,000 urine analysis for plutonium. But they want to go further and make epi studies, and they really didn't have quantitative measurements for the very early period. So that's why they used this bunch of measurements together with a very tailored expert assessment methodology, also to create quantitative measurements for the workers who was employed before 1963. And here you see the job exposure matrix results together with actual measurements. And as you can see, the exposure distribution is very similar. The absolute values are quite different, but they have methodologies to take this into account. Okay, so that was 3 examples of not so normal or frequent exposures. Then a few remarks about why when we use this job exposure matrices. So when we do not really have the possibility to use individual measurements, and that is the case for population-based studies, for register-based studies, and also if you're interested in historical measurements. And still, I think the most beautiful example of this is SynGEM. And I will not talk more about SynGEM, just again mention that it covers 5 different exposures. And the next example is about asbestos. So in this asbestos quantitative job exposure matrix, Susan and colleagues included nearly 30,000 measurements. And what they were able to do in this study here, where they looked at exposure response analysis of asbestos and lung cancer, was to provide very detailed information and also provide information of different subgroups. So they were able both to include more different lung cancer types and provide information for never and ever smokers and for men and women. And they were able to contribute really new important information who wasn't available before this study. So this is really a classical example of how, when you have a good quantitative job exposure matrix, you can really add to the current knowledge. The second example is about mechanical exposure and operation for shoulder disorders. This is a nationwide register-based study from Denmark. This article here, in this article, they used a job exposure matrix, and it was expert-based, but calibrated against several hundred measurements of several hundred technical measurements. And by using this job exposure matrix, they investigated the risk for surgery for subacromial impingement syndrome in relation to intensities of different occupational mechanical exposures. And here you see their main results. So on the x-axis, you have the exposure duration, and on the y-axis, you have the odds ratios. And on the left-hand side, you have the intensity for arm elevation. On the right-hand side, you have the intensity for repetition. And with regards to arm elevation, it was clear that even for low intensity of arm elevation, you could see an increased risk with exposure duration. Whereas for repetition, there was only an increased risk for the highest intensity category. So I think this is another really, really nice examples of how you can use good quality JEMs and get important and interesting results. In the next situation where a job exposure matrix can be used is if you have individual and self-reported measurements and you are in a situation where you really think that it might introduce systematic bias. And I think that one key example here is psychological exposures, where you by definition have issues with self-reported measurements. And it was very nice shown by a PhD student from Ocean University Hospital some years ago. So he made a meta-analysis where he looked at 38 follow-up studies looking at the psychosocial working environment and new onset depression. And he could see that that the results really systematically differ whether they use self-reported exposure or not. And within the psychosocial area, this issue has been dealt with in different ways. I think some of the most interesting tools has been to group the psychosocial exposures by work unit. So instead of using the self-reported information about psychosocial exposures, you simply use the average of the work unit. And this approach has been used in more papers. Here I show you two papers, one on job strain and ischemic heart disease, and one on organizational justice and risk of depression. And in both these studies, they were able to show significant findings for psychosocial exposures and the outcome of interest. This is not exactly a job exposure matrix, but for the last 10 years, there has been a lot of studies using job exposure matrix for assessing psychosocial exposures. And I think one example is a quite recent publication dealing with risk of childhood asthma following prenatal exposure for negative life events and job stressors. And it's a national-wide register-based study from Denmark. And in this study, the job stressors was exactly measured by job exposure matrices. But there are a lot of examples. So the third situation where job exposure matrix or a group-based approach is of importance is if individual measurements introduce bias. And I think Lex covered this issue very good. But let's just talk 30 seconds about this simple figure here. So here you have two persons, a red person and a black person. And they had dust measured 3 times on poultry farms. And on average, the exposure for these two persons was exactly the same. But it's also very clear from this figure here that if you only have used a measurement from day 1 or from day 2 or from day 3, you would have measured very different exposures for these two persons here. So that is the reason why you will have a lot of attenuation if you only have one or few measurements per person and you have a large within to between worker variability. And I mean, we have prepared, and I knew that Lex would use this example to show this, but it's just the most fantastic example. It really shows how a large within to between worker variability gives you a lot of attenuation if you have few measurements. But I think I will stop here. I think that Lex also make this point very clear. So if you have a large variability in your data, do not use one measurement per person, but use a group-based approach and use a good quality job exposure matrix. So to sum up, there are JEMs for nearly everything out there. And JEMs is especially useful if individual measurements are not an option, when individual measurements introduce systematic bias, and when individual measurements introduce attenuation. So thanks a lot, and I will give you the word back to you, Henrik.
Thank you very much, Vivi, for a very nice talk. And we are 5 minutes late, but I think we should wait for some questions for Susan, Lex, and Vivi. So please, I think you just unmute and speak up. So Max, it's not a raised hand, or so, and you can of course raise your hand, but if I don't recognize it, please just unmute and speak up. When waiting for a question from you, I have a question for the presenters. You all put very much focus on the quantitative JEMs, and they are indeed promising. And I think these are surely the way forward. What do you think? What is the future of the expert-based JEMs? When will they still be relevant?
Shall I start answering that, I guess? I think it's still important to have expert-based JEMs because the example that I showed for SynGEM, I think it is a really important step forward to use measurement data, but we don't have measurement data for all the exposures that we are interested in. So, and what we've also seen with developing SynGEM is that you need a lot of measurements to cover, well, the important jobs, time periods. Well, if you want to look into different regions, you need a lot of data. So if you don't have that data, then the expert assessment is still very valuable. And also I want to also point, and I think I alluded to that a little bit within SynGEM, we use measurements, but I think only relying on measurements is not enough because measurements are not being done randomly. So the expert step is always important to, well, to keep, I think. But I would like to hear Lex and Vivi's point of view there as well.
Yeah, so yes, but I think you put your finger on the right spot, Susan, because I mean it's impossible to anticipate a situation where you for 400 job groups have measurements. It will never happen. So I think we will continue to need an approach where we combine measurements and some kind of expert judgments. So but of course the more measurements the better, but we will never have a situation where the expert input will not be needed, I think.
Do you have a comment also, Lex?
Yeah, my initial thought was never trust an expert. And that's maybe a warning that I think there is no room for job exposure matrices based on expert opinion when there is a JEM available with quantitative information. And so I really urge people to use the database that Suzanne has created on available JEMs, and only rely on expert assessment if you venture into exposures that are not captured very well of particular situations. But then also ask yourself the question, who is an expert? And I have been an expert in different JEMs myself, and some of my JEMs didn't perform very well compared to other JEMs. So it's not that easy to do. So be aware of it.
Thank you,
I think
Lex.
to add to that as well, like with expert JEMs, of course, well, Lex and I have been working on JEMs together as well. And I guess you always need different opinions as well. So one expert is not, an expert will disagree. And there will never be a perfect answer, I guess. But I think it's important to have this expert step in JEMs also to judge on the value of the data and how to use the data. And but of course, there is a lot of discussion between experts, or well, whoever calls themselves experts. That's also, I guess, a thing. But it's, yeah, I think we need different types of information and combine that.
Thank you, Susan. Any other questions from out there? I have a question. Until now, at least as far as I am informed, threshold limit values for long-term effects of occupational exposures have been based on industrial cohorts with industry-specific exposure information that is very detailed. And my question is to all of you, but perhaps mostly for Susan. Do the general population JEMs now have a quality that we think they could contribute to threshold limit value setting on long-term effects?
Yeah, so I really think that what we also have shown with SynGEM, if you look into the papers, is that, of course, in these industry-based studies, you have very high exposure. You have a very high exposed population. But if you look into the general population, you have people of all types of jobs. So people high exposed, but also low exposed. And what we showed there for asbestos and also for silica is that also at the lower level, lower exposure levels, there's still an increased risk of lung cancer. And I guess that will be the same for other diseases as well. But you can only show that if you have this high quality exposure assessment. And so I think we do need a lot of general population studies on this rather than just industry-based studies. I think, again, here we need both. But if you only focus on the high risk, well, the very high risk group, the high exposure, and then, yeah, you don't know what the exposure level is at the, the risk is at the lower exposure level.
The floor is free, or the mic is free. I have a question for you, Lex. You never trust an expert. May I hear, do you trust a participant responding on a questionnaire on psychosocial factors? When I refer to what Vivi said, are individual level information on psychosocial exposure sufficiently valid to be trusted, or should we here go for JEMs or other independent exposure measures?
Well, the problem with many of the psychosocial factors is that it is pretty tough developing a more objective measure. Take work pressure as an example. So I am quite optimistic about research that I've seen where you pool in a JEM the information together. But recently, I have seen interesting papers on, for example, quality of leadership, leadership justice, where they used both the individual estimates and the group-based estimates. And they used them both in one model. And then basically what happens is that at job level, you have a particular estimate that is based on the average of 30 or 40 questionnaires, which is the JEM-based approach. And at individual level, you have the deviation of that individual from the average determined by his or her peers. And that is very interesting, because then you can compare across different jobs, and you can also compare whether persons within a particular job who have a different opinion than others, whether that is information for your health point of interest. So I think that is where I would go. It is, yeah, you can use it in different ways. And I've seen some interesting examples lately. So I would encourage people to, to try these multi-level strategies in also in questionnaires.
Thank you very much, Lex. So I think there is room for one last question for the presenters or comments, please. It does seems to be the case. Thank you very much, everybody, for participating in this webinar. There will be more, isn't it right, Ingrid? I'm not updated when the next will be, or does it have a title?
It's going to be in September, and what's the title? I'm not quite sure. Sorry. Yeah, it's a cancer. It's about cancer. I think 21st of September. I don't have a more specific title yet, but that's what it's in the program right now. But we plan to continue. OmegaNet has got an extension until April next year, so we plan to continue with webinars after October also.
Thank you very much, Ingrid, and goodbye, everybody.
And have a nice summer.
Yes, enjoy summer.